This weekend, Florida's Surgeon General confirmed his office did not conduct any analysis to project how removing school vaccine requirements would affect children in the state. The rollback of some vaccine rules is expected to take effect in the next 90 days. This comes as vaccination rates nationwide are decreasing. CBS News medical contributor Dr. Celine Gounder joins me now for tonight's interview. So start me off, doctor, with just exactly what Florida is changing here.
So Florida Surgeon General Dr. Joseph Ladapo has announced plans to start dismantling childhood, or rather school vaccine requirements. This would be the first state to do this in modern U.S. history. So really quite a stark change from what policy has been until now. The state health department can take action on certain vaccines already. So that includes hepatitis B to prevent liver cancer, chickenpox, also known as varicella, and two bacterial vaccines, one for Hib, also known as Haemophilus influenza, and the other one pneumococcus. Those are infections that cause everything from ear infections to sepsis to meningitis in babies. For other vaccines, it will require action by the state legislature, which will next be meeting in January. But Ladapo is saying he really wants to push the legislature to get rid of the other mandates as well.
And mandate basically means you can send your kids to school, whether they've gotten any of these shots or not. Is that essentially it?
Yeah, so the school vaccination mandates requirements are that if you attend public school, that you need to be vaccinated. Now, private schools can do their own thing, but if you want to attend public school, you need to be vaccinated.
So the Surgeon General told Jake Tapper that he didn't have to do any research because this is a question of personal freedom. So if it is personal freedom, why do they have to do the research?
It's a great question. And there are very real implications. When you change a policy, especially a long-standing public health policy like this, are you projecting how many kids are going to get infected? What is that going to mean for ER visits and hospitalizations? What is it going to mean for kids' absenteeism from school, from parents needing to stay home with kids? And remember, during the pandemic, we had shortages of all kinds of things, like ventilators. Will hospitals have enough ventilators for kids who end up in the ICU with these infections?
Right. So it's not just an abstract theological or question of philosophy. It's actually got real world impacts. In addition to that question, then, help people understand about, OK, I don't want to do this for my child. How might that affect the health of other kids that they might go to school with?
Well, one of Dr. Ladapo's arguments is that these, at least some of the vaccines, are not perfect in preventing transmission. That is not the only reason this is in the interest of a community of public welfare. For example, pediatric hospitals, hospital beds have been cut by about 20% since 2008. If you'll remember, during the RSV surges we saw in 2022, 2023, the pediatric ERs and hospital beds were overwhelmed. They didn't have enough supply for everybody. And so these are shared resources. If somebody in your community is choosing not to get vaccinated, their child ends up in the hospital, that may mean fewer hospital beds for kids who end up with any other number of medical conditions.
And so how have people's feelings about vaccines changed, and how has that affected actually children's health to the extent that we know?
Yeah, I mean, I think the central area of tension politically during the pandemic is how much are people willing to sacrifice individual freedoms in exchange for doing something that is in the interest of the public's health. And unfortunately, in this particular case, it may well mean children have lower vaccination rates, are more vulnerable, as well as other vulnerable people in the community, the immunocompromised and so on, may find themselves paying the cost here.
And so we have about 30 seconds left. Let's imagine other states try and compete and do the same thing. How might that play out?
Well, we'll definitely see increases in infectious disease outbreaks. We'll see more hospitals spread thin, unable to care for all the patients that they're being asked to see. And, I think this is really turning back the clock to some 50 years ago. We'll see things we haven't seen in many, many years.